there. My name is Paul Wallace. I'm a Brown medical student. I was born in Providence, lived in Gloucester when I was young, now live in Providence again. Since I've been at Brown, I've had the opportunity to get involved at the Center for Alcohol and Addiction Studies at the university, as well as distributing naloxone in the community. And I plan to go into addiction medicine in the future and devote my life, my medical career, to treating people with substance use disorders. So I'm going to approach this topic from a medical perspective and talk about some the proven ways that we know of that help save the lives of people who have substance use disorders. One of those ways is increasing access to methadone and Suboxone, as well as behavioral health services. Another way is increasing access to clean needles and safe places for people to use drugs. And a third way is increasing access to naloxone, as well as emergency medical services. Some clarifications and statistics on those topics, because the committee asked about them earlier. First of all, naloxone does reverse fentanyl overdose. Naloxone binds to opioid receptors with greater affinity than fentanyl does, just as it does bind to opioid receptors with greater affinity than heroin does. There have been cases where people require multiple doses of naloxone to be reversed from fentanyl, but there aren't any reports of fentanyl being irreversible with naloxone. Also, this concept of people dying instantly when they take fentanyl isn't backed by any medical literature. The way opioids kill people is by causing respiratory depression. So, in layman's terms, basically people stop breathing. If they have access to naloxone as well as emergency medical services in a prompt amount of time, this can be reversed and people's lives can be saved regardless of their dose of fentanyl. Some perspective on naloxone administration in Rhode Island. In 2017, there were 527 naloxone kits administered in Providence, about half that in Warwick and Pawtucket, and 61 in a town like Coventry. There are also 400 emergency department visits from people in Providence in 2017. In 2016, 2,000 people were admitted to treatment in Rhode Island. And there are currently over 5,000 people on methadone in the state of Rhode Island and 4,000 people on Suboxone. These statistics are provided by the Department of Health and can be viewed on preventoverdoseri.org. I want to talk briefly about some things that haven't been proved to save the lives of people with substance use disorders. As I'm sure you're all aware, there's a high standard in medicine to have evidence to prove any sort of treatments that are offered. And we've seen time and time again that imprisoning people for life who sell drugs, which is something that's been alluded to before, is on the books in numerous states, has not proven to save the lives of people with substance use disorders. It doesn't reduce the demand for drugs, and it doesn't reduce the supply of drugs. What it does do is it costs taxpayers millions of dollars that could be going towards these proven methods of treating people with substance use disorders. It also targets disproportionately, as we've heard before, people who have substance use disorders themselves and are involved in low levels of dealing. This has been borne out in numerous states such as Ohio, Wisconsin, as we've heard before, who have policies like this. And we've seen time and time again the best way of eliminating these low-level drug dealers is by getting them into treatment rather than putting them in prison. In conclusion, I just want to sum up, as committee members have alluded to already, we do have a health crisis in the state having to do with opioid use. It's not a legal crisis. And the way in which we can help those who have substance use disorders is by giving them access to health care rather than access to prisons.
Vice Chair McEntee. Vice Chair Jela.
Thank you, Chairman Keeble. You mentioned number of people currently being treated with Suboxone and methadone. Could you give me those numbers again?
So there, according to the Department of Health numbers, there are 5,576 people currently prescribed methadone in Rhode Island, and 4,739 people currently prescribed Suboxone. So about a little over 10,000, and I couldn't give you an estimate of what percentage of people with substance use disorders that represents, but we can assume it doesn't include all of them.
Would you hazard a guess that it's half, or
I would hazard a guess that it's probably less than that.
less than half of the addicted people in Rhode Island are receiving treatment with either methadone or Suboxone?
Probably, I'd say half would be the most I would guess.
Thank you.
Thank you. Any further questions? Thank you so much. Flippy, would you like your votes recorded?
I would like my votes recorded. I also have a question,
Sort of.
please, Chairman.
Yes.
Has there ever been an analysis of what percent of people, and we'll use heroin, are purchasing the drug communally as opposed to someone purchasing from someone who's a dealer? For instance, a scenario of one person going, everyone gathering money, and one person going and purchasing that heroin and then bringing it to the group. My understanding of current law is that that person who brought it to the group could be charged as a trafficker. Has there ever been an analysis, and probably not because it's a difficult question, as to what percent of people who are getting higher on heroin are purchasing it through that way or purchasing it from someone who's an actual trafficker?
I can't provide you with a publication, but anecdotally it seems like that's quite a common practice.
And so I don't know if you've read the bill. So maybe I'll just make a comment, because I'm not asking the witness for a legal analysis, but I would have a real problem making that person liable for the death of someone who they're getting high with and sentencing them to prison for life. Because if someone's a trafficker and they're out there selling this as their primary source of income, that's one thing. But if you have someone who's an addict and there's a group of addicts and they're getting heroin for each other when they can, I think this bill would problematically affect them.
And I think Mr. Gleppo alluded to this. Oftentimes the way prosecution of these things goes is you start from the person who overdosed and work your way up, and you end up prosecuting the highest person you get in the chain, and oftentimes that person is someone who has an addiction themselves. We're not talking about prosecuting these drug production facilities more often than not.
Yes, Representative Roberts.
Thank you. Did I hear correctly when you said there were 61 deaths in Coventry?
That's 61 naloxone administrations in Coventry. So those are 61 instances in which someone had presumably overdosed and was reversed with naloxone.
Okay, thank you.